And we're back, dear viewers, on this beautiful evening. We're joined by Dr. Shaima Mohammed Albeloushi, a scientist at the Asman Diabetes Institute and chairperson of the Animal Care and Ethics Committee on the phone line. Good evening to you, Doctor.
Hi, good evening.
It's a pleasure to have you on our show, and we'd love to know for us and our listeners today the importance of the Asman Diabetes Institute and what it does to the public.
Thank you, and it's a pleasure of mine that you're hosting me on your show. Well, everybody knows this man, and of course, under the direction of Dr. Faisal and Professor Fahad, and the support of KFS, we're doing research on diabetes. So at the Asman Diabetes Institute, our focus is on understanding diabetes and its complication, as well as the metabolic syndromes, such as obesity. Unfortunately, diabetes is affecting a large population, actually a large portion of our population. So we're trying to identify early risk factors to develop a better treatment and prevention strategies.
All right, that's pretty interesting to know more about what the Asman Diabetes does. And Dr. Shaima, would you please explain in simple terms to our dear viewers about diabetes and what it means?
Well, first of all, we need to understand what is glucose and what does it do inside our body. It's very simple. When we eat, for example, a piece of a bread or a biscuit, the first thing happens is we chew it in our mouth. This is the first part of our digestion. Then it goes into our stomach, our intestine, then it will be absorbed into our blood. Once it goes into our blood, there will be a signal telling the body that the glucose is high in the blood. Here we will trigger the insulin, or beta cells that produces insulin. Beta cells that can be found in the pancreas. So once there's a high glucose in the blood, insulin will be produced. Why? Because we need energy. And glucose, when it is entering the cells, we will produce energy. But unfortunately, it can't enter the cells until the insulin opens all the gates which are available around the cell. So the insulin will come, opens the doors or the gates, and glucose will enter into the cells, and it will produce energy. That's for a normal metabolism. If we don't have enough insulin, if our body is resisting to the insulin, these doors doesn't open, by which glucose will remain in the blood, will not be consumed by the cells. So here we will have diabetes, which is an increase of blood glucose concentration due to insulin resistance or low amount of insulin. And of course, we're talking here about type 2 diabetes.
All right, that's a pretty clear clarification for us and our dear viewers about the terms and the information related to diabetes. So, Dr. Shaima Albeloushi, we want to know, why should people really focus on diabetes?
Well, diabetes was known or common to be around, older adults, particularly the people who are 60s and above. However, this pattern has changed in recent years, and unfortunately, children, teenagers, and young adults are becoming or being diagnosed with diabetes, especially type 2. As a result, diabetes is no longer considered a condition limited to older population, but is growing health concerns across all age of groups. This shifts largely because of our lifestyle. Factors such as poor diets, the quality and the quantity of the food we're eating, physical inactivity, the sedentary lifestyle that we're having, and all these things will lead to an increase of obesity and diabetes.
All right, and I'm sure our dear viewers love walking in the beautiful rains and the weather that we have during April. And
yeah, definitely.
yeah, so Dr. Shaima, we want to know why research is really essential in diabetes, since we have current treatments too.
Well, the current treatments help manage diabetes, but they don't cure it or fully prevent its complication. Research allows us to understand the disease at a deeper level. For example, why it develops, why some patients respond differently to treatments, and how we can prevent it altogether. Without ongoing research, progress would stop, and we wouldn't be able to address the rising rate of diabetes.
All right, and Dr. Shaima Albeloushi, we want to really know more about your research and your technological tools that are using in the Dasman Diabetes Institute.
Actually, I'm working on a couple of projects, but mainly my work is based on beta cells, the cells which are in the pancreas and they produce insulin. And I study these cells in different conditions, in normal condition and under stress. These are stress such as fat, food with high-fat diet, sugar, different type of sugar, and inflammation. I check on these stressors, and we will check if there is an increase or a decrease in these number of cells, their function, insulin production. That's the main aim of my work. How can we manage beta cells to produce a better insulin?
All right, that's a pretty deep scientific research work that you are doing, Dr. Shaima
Yes, it
Albeloushi.
is.
And we want to know about your work and how does it benefit the people inside our lovely Kuwait?
Well, diabetes rates in Kuwait are among the highest globally. So our research is highly relevant, you know. We study factors, a specific one to our population, the genetics, the diet, the lifestyle, to develop targeted prevention and treatment strategies. This ensures that the healthcare solutions are not just imported from outside, but it is tailored to our community.
All right, and Dr. Shaima Albeloushi, really we want to hear a last message from you to share to the public watching us today.
Actually, prevention is very powerful. Maintaining a balanced diet, staying physically active, and monitoring key indicators like blood glucose, weight, can significantly reduce the risk. Regular checkups are also important, especially for those with family history. Small, consistent lifestyle changes can make a major difference. So diabetes is a serious but manageable condition, and in many cases preventable. Research is continuously improving, and it's helping us to understand it better. But public awareness and lifestyle choices are equally important. So working together, scientists, healthcare providers, and the community, we can significantly reduce its impact.
Hopefully, and really would love to really thank you for joining us on Hala Kuwait and spreading the message really, and would love to thank all the people and staff at the Dasman Diabetes Institute also. So dear viewers, let's thank Dr. Shaima Albeloushi for joining us on Hala Kuwait, a scientific researcher at Dasman Diabetes Institute and also a chairperson of the Animal Care and Ethics Committee. Therefore, dear viewers, we shall take this next report, so stay tuned and we shall be right back.